Good afternoon. I'm Amy Rowley-McGee, the president of the Health Policy Institute of Ohio. Thank you for joining the first meeting of the Strategic Action Plan on Aging Advisory Committee. Before we get started, I have a few housekeeping items. For now, everyone is in listen-only mode. We want this to be an interactive meeting, however, so if you have a question, please type it into the question box on your screen. As I mentioned before we officially started this webinar, we recommend that you, if you don't have a microphone on your computer, that you also log in using a phone so that the audio is better if you choose to speak during the call. When we get to that point, if you would like to speak, please raise your virtual hand on the screen and we will unmute you. You have to, though, have entered your audio PIN in order for us to be able to unmute you. So please remember to do that. Both the slides and a recording of today's webinar will be posted on the SAPA Advisory Committee page. You can find this by going to hpio.net and clicking on Groups. HPIO is facilitating development of the Strategic Action Plan on Aging, or the SAPA, as you will hear it be called, under a contract with the Ohio Department of Aging. We are joined this afternoon by Director McElroy, the Director of the Ohio Department of Aging. You will also be hearing from my colleagues, Reem Ali, who is leading this work at HPIO, and Zach Reet, our Director of Data Management and Analysis. We are convening this group to provide ODA and HPIO guidance throughout the process of developing the SAPA, as you see here. Here is the agenda for our meeting today. And here are the meeting objectives. With that, I'll hand it over to the director to provide more context on this work.
Okay, thank you, Amy. First, I'd like to give a special thank you to the Health Policy Institute of Ohio for working with us on this really important effort. We are really excited to lead off today with the Strategic Action Plan on Aging, or the SAPA. And I also want to thank all of you who are present today for taking your time and recognizing how important this issue is. Our mission at the Department of Aging is to foster sound public policy, research, and initiatives that benefit older adults. And certainly working through the SAPA, being able to put forth really good policy, really good initiatives is going to take us in the right direction. I think it's important always to have context for the work that we do. Today, when we consider the state of aging in Ohio, we know that Ohio is the 6th largest 65 plus population in the nation. There are approximately 2.8 million Ohioans over the age of 60, and our 60 plus population is growing at a rate 28 times faster than the rest of the population. So certainly this is timely. We also know that where you're born and live often can have more influence on your ability to stay healthy than your family history of illness. In certain parts of Ohio, there is as much as a 24-year difference in life expectancy for people living within 10 miles of each other. Access to affordable housing, transportation, and nutritious foods, as well as safe neighborhoods and healthy behaviors, determine health outcomes more than genetic makeup. And so when addressing these community conditions or social drivers of health, it's important that the unique needs of older adults be considered. Efforts to address health inequities across the state must be intentional and inclusive of older adults. And it begins by promoting health literacy within our communities and with our leaders, hence why we're all gathered here today. Our department is prepared to work collaboratively with many of the departments within the cabinet, in particular the Departments of Health, Job and Family Services, Transportation, and others, to shape policies across sectors that will promote healthy aging. And as a state, we know that we have this opportunity to address many of these avoidable differences, such as access to safe, affordable housing and reliable transportation to medical and non-medical appointments. Often these things are the difference between aging in place or premature displacement from one's home. So this is our time to demonstrate that in our state, people can live where they choose, with whom they choose, and with opportunities to participate fully in their communities. And I hope through the work of this advisory committee and many of the other things that we will put forward, that we can develop the policy framework that supports aging in place in all areas of the state. While we have the opportunity to develop a strategic framework that's required of us by the Federal Older Americans Act, we also have the opportunity to provide leadership that improves and promotes quality of life and personal choice for older Ohioans, adults with disabilities, and their families and caregivers. We do have a state plan on aging that currently covers the years of 2019 through 2022. And this plan was built upon a comprehensive statewide needs assessment that provided a clear perspective of older adult needs. One of the things in coming into the department right away was that I recognized that while we have this really great document, our state plan on aging, we also had running concurrent a really great document, our state health improvement plan, or our SHIP. And looking at the two, it just seemed to make sense to me that if we had an opportunity to integrate the work, we could be more purposeful, more strategic, and we can certainly leverage opportunities that perhaps were missed. And so with that, we did ask for HPIO to join us. They were gracious enough to do so. And so I'm really excited about what we will learn today. I'm really excited to hear from you and some of your ideas as we move through this work here today and what we have before us. And so with that, I will now turn it over to Reem.
Thank you, Director. We are very excited at HPIO to be working on this project and look forward to creating an actionable plan that improves the health and well-being of older Ohioans. Good afternoon, everyone. This is Reem Ali with HPIO. Before I dive into the process and timeline for this work, we do have a little poll question for all of you. We'd like to get a sense of whether you have participated either on the State Health Improvement Plan Advisory Committee or contributed to the State Plan on Aging. So we'll give you a minute or two to fill out this poll and let us know if you have either participated on the State Health Improvement Plan Advisory Committee or contributed to the State Plan on Aging. And as the director mentioned, the SHIP was developed as part of the Ohio Department of Health's accreditation process, and the State Plan on Aging was facilitated by the Department of Aging. We'd like to get as many folks as possible to respond, so we'll give you another minute or two, or just a few seconds. Again, we'd really like everybody to respond to this poll so we get a sense of whether you're not familiar with the SHIP or with the State Plan on Aging. We'll go ahead and share the results. All right, so we see about a quarter of you have participated as part of the State Health Improvement Plan Advisory Committee, and about another fifth of you have participated on the State Plan on Aging, and then another fifth have participated on both. So we have a good number of you that are familiar with either one of or both of those plans. So that will be great. And for those of you that may not be as familiar, we will give you more context this afternoon. As Amy mentioned, we have been contracted by the Department of Aging to facilitate development of the Strategic Action Plan on Aging, or the SAPA, as you will hear us call it. This includes developing a summary assessment of older Ohioans, which we will complete by the end of next month, and the SAPA, which we will have complete by the end of July of this year. We will also assist in dissemination of the SAPA and developing some technical assistance materials to inform SAPA implementation through the months of August and September. For those of you who are familiar with the state health assessment, the summary assessment of older Ohioans that we are working on will be similar. It will provide a comprehensive picture of the health and well-being of older Ohioans to inform development of the SAPA. The summary assessment will include a prioritized set of secondary measures that provide data and information on the health and well-being of older Ohioans, which will be supplemented by key findings from the primary data that was compiled in development of the State Plan on Aging. My colleague Zach Reet will provide you with an update of this work that is currently underway. As Director McElroy described, the SAPA will be a prioritized and specific action plan that state and local partners can use to ensure all older Ohioans achieve their full health potential. The SAPA will be informed by the summary assessment of older Ohioans. It will build upon the State Plan on Aging and align with the State Health Improvement Plan. Here is a more detailed view of the activities we will be engaging in over the next few months. Upon completion of the summary assessment of older Ohioans, we will begin prioritizing topics to include in the SAPA, which will also be informed by priority work teams and key informant interviews. As part of our work, we will also be making recommendations around the Department of Aging's data collection, evaluation, and performance management systems to better align with the goals of the SAPA. This advisory committee, along with members of the priority work teams and key informants, will be instrumental in prioritizing the topics that we focus on in the SAPA, including setting SMART objectives, which are specific, measurable, achievable, realistic, and time-bound, informing performance targets, identifying priority populations when possible, which are the populations that are most in need. All right, folks, sorry for that little technological challenge. I'm going to back up a slide and just make sure that you heard what I was saying before. This is a detailed view of the activities that we will be engaging in over the next few months. Upon completion of the summary assessment of older Ohioans, we will begin prioritizing topics to include in the SAPA, which will also be informed by priority work teams and key informant interviews. And as part of our work, we'll be making recommendations around the Department of Aging's data collection, evaluation, and performance management systems to better align with the goals of the SAPA. The advisory committee, along with members of the priority work teams and key informants, will be instrumental in prioritizing the topics to focus on in the SAPA, including setting SMART objectives, which are specific, measurable, achievable, realistic, and time-bound, informing performance targets, identifying priority populations, which are populations that are most in need or at greatest risk for poor outcomes, and identifying evidence-informed strategies that can lead to improvement on set objectives. In creating this advisory committee, we were very intentional in reaching out to a wide variety of partners and sectors. We are happy to say that we have 55 individuals or organizations participating on this advisory committee, representing all of the sectors that you see here. Amy shared this slide before, but now that you have more context on this work, I wanted to share with you again the role of this advisory committee. And I'll give you a few seconds to look this over. All right, before we move on, I wanted to give you all a chance to ask any questions you might have. Please feel free to enter your question into the question box, or you can raise your hand using that hand icon and we will unmute you. Note that if you have muted yourself, then you will need to unmute yourself as well. So I'll just give you all a few seconds if you have any questions so far on anything that we have covered. All right. Looks like we've covered everything so well. Nobody has questions, so we will move on. I also want to give you a quick explanation or refresher for those of you that are already familiar with the state health assessment and the soon to be released state health improvement plan. The state health assessment paints a picture of the health and well-being of Ohioans. It is descriptive and was designed to inform priorities in the state health improvement plan. The State Health Improvement Plan is a focused, action-oriented plan with prioritized topics based on data in the state health assessment. What you see here is the most current draft version of the conceptual framework for the 2020 to 2022 State Health Improvement Plan. This framework was designed to be easily understood by a wide variety of partners, including partners outside of health. It is a tool that is used to outline and organize the areas of focus in the SHIP and their relationship to the SHIP's long-term outcome and vision. It also answers the questions, what shapes the health and well-being of Ohioans, and how will we know if the health of Ohioans is improving? As you see here, the SHIP has a clear vision or end goal that Ohio is a model of health, well-being, and economic vitality. The SHIP conceptual framework also puts a strong focus on equity. It includes the Ohio Department of Health's definition of equity and highlights a long-term outcome working towards achieving the SHIP vision that all Ohioans are able to achieve their full health potential. Working backwards, the SHIP identifies 3 health outcome priority topics in green and 3 health factor priority topics that shape health and well-being in blue. The health factor priorities are often referred to as the social determinants or social drivers of health. And for each of these priorities, the SHIP attaches specific, measurable objectives to track the state's progress over time. As you heard from Director McElroy, the purpose of the SAPA is to build upon the State Plan on Aging and align with the State Health Improvement Plan. To answer this question, what are the most urgent priorities to focus on to achieve health and well-being for older Ohioans? To help define the scope and focus of the Strategic Action Plan on Aging, we developed this draft conceptual framework. This framework both builds off of the State Plan on Aging and aligns with the State Health Improvement Plan, but with a specific focus on improving the health and well-being of older Ohioans. Similar to the State Health Improvement Plan, it answers the questions, what shapes the health and well-being of older Ohioans, and how will we know if the health and well-being of older Ohioans is improving? We have uploaded this draft conceptual framework document to the webinar, and you can download the document if you'd like to take a closer look. It is in the handouts section that you see on your webinar. The vision within this conceptual framework for the SAPA is that Ohio is the best place to age. The conceptual framework also aligns with the SHIP's equity language and puts a strong focus on addressing ageism and ableism. And similar to the State Health Improvement Plan, the SAPA identifies 3 priority factor topics impacting the health and well-being of older Ohioans: community conditions with a focus on livable communities, health behaviors with a lens on prevention and self-management, and access to care with a focus on home, community, and clinical-based supports. And the SAPA also identifies 3 priority outcome topics that indicate health and well-being for older Ohioans. Those are civic and social engagement, population health, and functional independence. You'll note that under each of these priority topics, it says examples only. So just as a reminder, this conceptual framework is meant to be an outline or empty shell. Specific priority objectives will be identified through the prioritization process that will occur over the next few months. This prioritization process will be informed by the State Plan on Aging, the State Health Improvement Plan, the findings from the summary assessment of older Ohioans, and stakeholder input, including your input as part of this advisory committee, and input from the priority work teams and key informant interviews that we will facilitate over the next few months. Here, you see examples of the types of specific priority factor outcomes we might decide to focus on in the SAPA through this prioritization process. For example, we may decide to focus on elder abuse and neglect as a community condition, tobacco use and physical activity as health behavior, and home health under access to care. We will focus on no more than 1 to 3 measurable objectives per each priority factor topic. And here you see examples of specific priority outcomes. Again, these are just examples, and we will go through a prioritization process to identify 1 to 3 measurable objectives to focus on per priority outcome topic. To reiterate what has been shared earlier, the end goal of this work is that the SAPA provides state and local partners with a strategic set of priorities to focus on, evidence-informed strategies to align with, implement, and allocate resources to, and measurable objectives to evaluate progress towards improving the health and well-being of older Ohioans. This will require a coordinated approach that ensures all state and local partners that you see here are rowing in the same direction. Now we'd like to open it up for some feedback from all of you on this draft conceptual framework. And we'd like to ask the question, what changes, if any, do you think should be made to the SAPA conceptual framework? A reminder, if you'd like to weigh in, please use the hand icon and we will unmute you. We're thinking about what changes, if any, you think should be made to this draft SAPA conceptual framework. Again, here is the conceptual framework. So you can reflect on this question, and please note you can also download it from the webinar. It is located under handouts. Just to get you thinking a little bit more, the purpose of the conceptual framework is to outline the scope and focus of the Strategic Action Plan on Aging. So if you can think about in what ways we could strengthen the conceptual framework to achieve this goal. All right, we're just taking a look to see who has raised their hands. Remember to please use the hand icon. We'd really love to get your feedback. I know it's a lot to absorb right now. We do have a question or a comment, maybe. Let me just open that up. Is there a way to include barriers to change? For example, direct care workforce shortage. And And this is from Lark. Lark, thanks for that comment. And so that is something that could potentially be addressed under access to care. So as I mentioned earlier, this conceptual framework is a shell or a outline, and we will be going through a prioritization process to then identify what the specific areas of focus are going to be for the strategic action plan on aging. And that workforce shortage or addressing workforce is an example that is listed under access to care currently. We'll need to go through that prioritization process to then identify that it is in fact something that we do want to focus on. All right, and okay, and then we have a comment from Marie Curry. Marie, we're going to go ahead and unmute you.
Thanks. Actually, I was just looking at some of the sample priorities and had a thought about that, but I don't think that this is the right time. So I'm all good.
Okay, thank you, Marie. All right, and Teresa Long, we are going to go ahead and unmute you as well.
Hi there. Does this work?
It works. We can hear you.
Can't believe it. Hello. So my question is, and first of all, it looks beautiful and I like the connectivity across different plans. So good for folks who've been thinking about this. But when it mentions equity right at the top and then defines health equity and how that's achieved, it feels to me that this plan is really much broader than health equity. And it really is about equity in many arenas of life. So I just wonder how you all have been thinking about that. As you mentioned, is it just health equity, or is it just that equity is achieved when all people?
Thanks, Teresa. That's something that we can certainly consider as we think about revisions to the conceptual framework. Do we want to keep it a specific focus on health equity or broaden it to be equity in general? And then we have a question or comment from Catherine. Piggybacking on Lark's question, wondering about consideration of family caregivers and how they'll be considered in the plan. In that same bucket of access to care, we have identified caregivers as a potential area of focus for the SAPA. It will be something that we are also thinking about as we're developing the summary assessment of older Ohioans as well. So it's certainly something to consider as a priority area to focus on in the SAPA. And we have another comment from Steve Wagner. As to equity, will there be analysis looking at demographics, e.g. race? Yes, in the summary assessment of older Ohioans, there will be data that is disaggregated. And depending on what the data source is, it may be disaggregated by race. So that is certainly a part of what we are looking at. And then within the Strategic Action Plan on Aging, we will be looking to identify those priority populations. And if you're familiar with the State Health Improvement Plan, we underwent a similar process. And those are going to be the populations that are identified as being most at risk for poor outcomes. We'll be able to get at that in two ways. One way we'll be looking at data disaggregated, and the second way that we can look at that is through the key informant interviews. So we will be prioritizing representatives of communities that are or populations that are most at risk in identifying some of those key informants. Any other questions or comments, particularly any other comments or thoughts on how to strengthen this conceptual framework? Given the purpose of this conceptual framework, so outlining the scope and focus of the Strategic Action Plan on Aging. I just want to make sure that we don't have any hands raised. We don't see any at this time. I don't see any other questions in the comment box, but I'll just give you a few more seconds in case you are still digesting information and want to give some feedback. Of course, we always welcome feedback throughout this process. And so if there is something that you think of after this webinar, please feel free to reach out to myself or any of the HPIO staff, and we can certainly think about and consider that. We have another comment, and it's, I didn't see older adults as a target population for input. Am I missing something? Georgia, thanks for that comment. So this state strategic action plan on aging is focused on older Ohioans. That is the overall population that we are focusing on for this document. Let me just give me 1 second here. Another avenue to get at this is older adults as key informants. Okay, and then Zach will also get into the survey data that we will be using. All right, any other questions or hands raised? Okay, well, I am going to now turn it over to my colleague, Zach Reet. He will be giving you an update of the summary assessment of older Ohioans.
Thanks, Reem. As Reem already mentioned, the summary assessment of older Ohioans will inform the development of the Strategic Action Plan on Aging. My name is Zach Reet. I'm the Director of Data Management and Analysis for HPIO, and I'm coordinating the compilation and analysis of the secondary data that we'll use in this assessment. My colleague Haley Aka is working on the demographic profile and the primary data sections of that assessment. And the red boxes that you see here on the slide are all of the sections that will be included in this summary assessment. HPIO will be doing the work to compile and analyze data for the demographic profile and the secondary data sections of this assessment. That work is going to build on the Ohio Department of Health's online state health assessment and work that was done during the development of the state plan on aging. The primary data that was collected during the development of the state plan on aging will also be summarized in the document. And just to follow up to a question that was asked during that last segment, one of those sources of primary data was a survey that was fielded by the Ohio Department of Aging and completed by nearly 2,000 older Ohioans and their caregivers. So that's absolutely a source of the voice of older Ohioans in this assessment. Whenever possible, HPIO is going to use sources that are publicly available and easily accessible in this assessment. In the demographic section, for example, we'll be using data from the Scripps Gerontology Center at Miami University, and we'll use federal sources like the US Census and CMS, particularly their Medicare enrollment dashboard. HPIO staff is going to compile and analyze data from secondary sources, and the purpose of that work is to highlight key challenges and opportunities for Ohio's aging population. This analysis is going to be made up of approximately 50 indicators from a number of different sources, including ODH's online state health assessment, the AARP Long-Term Services and Supports State Scorecard, and America's Health Rankings Senior Report, as well as, I mentioned, federal sources like CMS and the Census. To prioritize the 50 indicators that are included in this assessment, HPIO and ODA used these criteria. I'll just highlight that fourth bullet point. To ensure that this assessment paints a complete picture, HPIO categorized indicators into 4 different groups and then made sure that we had good representation from each group in the set of indicators. Those 4 groups were health and well-being outcomes, healthy behaviors, community conditions, and access to care. To put the data about Ohio's aging population in context for this assessment, the analysis will compare Ohio's most recent performance on indicators to a national benchmark, and that national benchmark will be provided by the secondary sources that we use. We'll also look at Ohio's performance over time, or our trend, and for this analysis, we'll be using the 3 most recent years of available data. And then finally, to highlight gaps in outcomes between different groups, we'll be calculating disparity ratios. And those disparity ratios measure differences in outcomes that are due to differences in social, economic, and physical environments. During the development of the State Plan on Aging, ODA hosted 5 regional forums to collect the perspectives of older adults, their caregivers, and stakeholders in the aging network. They also administered a 66-question survey that was completed by nearly 2,000 older adults and caregivers. And data from both of these sources, the focus groups and the survey, will be summarized in the assessment, and the findings will be used to supplement the secondary data that we look at. Work on this assessment is underway. Generally, we're finding that there's a good variety of data on the health and well-being of older adults in Ohio, but we do have a few gaps that we're hoping you can help us fill in the secondary data. I'm just going to talk through each of these real quickly, and then we'll switch to the next slide where, again, we'll warm up for discussion. If you do have thoughts on any of these, please do start typing into the questions box or the chat box. The first gap is around chronic pain. Here we're looking for a state level indicator on the prevalence of chronic pain, or perhaps the prevalence of chronic pain that limits functional abilities. We'd also be interested in looking at the management of chronic pain. When we went out and looked for indicators on this topic, we did find some rather recent national research, but nothing at the state level. With regards to substance abuse, in the assessment currently, we have indicators around smoking rates and rates of excessive drinking for older Ohioans, but we don't have any data on the prevalence of substance use disorder, opioid use disorders among older adults. So if we could get an indicator of the prevalence of substance abuse, perhaps indicators related to the treatment, or maybe we've seen some indicators that are listed, perhaps like the percent of people who need access to substance use treatment but have been able to or not been able to get that treatment. The next gap is around nutrition and malnutrition. We know that these issues are very important for older Ohioans, but the indicators that we've found around nutrition are really about behaviors, the frequency of consuming fruits and vegetables, and would really like to get further into this, really look for an indicator that better highlights the scope of the issue around nutrition and malnutrition for older Ohioans. And the last gap is really around cost savings due to hospice care. Research says that people who move into hospice care in the final months of life experience a whole host of positive outcomes. Some of those positive outcomes are related to cost savings. Again, we've seen estimates at the national level for cost savings related to hospice care, but nothing at the state level. So now, after those brief sort of introductions to some of our gaps, I'd like to open up a discussion around what sources or indicators are you aware of to fill the identified gaps in secondary data. So again, I'll just ask you to type any comments into the questions box or raise your hand to speak. While I was talking, we had a few other questions come up. The first question is about the PowerPoint being available. the PowerPoint is available on the advisory committee webpage that we highlighted earlier. So we had a question about, were the 2,000 surveys spread geographically across Ohio? And the answer is that yes, they were. Okay. And Catherine's made an offer to try and help connect us with some good data around hospice care. So I really appreciate that offer. Births factor surveys done at the county level. We haven't done a lot of looking at the Burfus data broken down by region and by age at this point in the assessment. So sorry, we had a question. You can't read the questions I'm looking at. We had a question here. Have you looked at the behavioral risk factors survey done at the county level? And the answer was that no, we have not looked at those regional estimates stratified by age in this assessment yet. But we certainly, yes, but we certainly are looking at Burfus as one of our data sources. All right, Megan, you've got your hand raised. Megan Richwine, we've got you unmuted. Megan, are you able to talk to us? Okay. All right, we don't have any other questions typed into the question box, and nobody else has their hand raised. So just a reminder, you can email us with any sources or indicators that fill in these gaps or other gaps that you might think we should be looking at. So we have a question, does Ohio participate in the National Core Indicators Aging and Disability Data Set? And the answer is that yes, we do. We have another question here. Why is hospice the only treatment? Hospice is the only treatment that showed up in our data gaps. It is not the only indicator of access to care or access to services for older adults that we'll be looking at in the assessment. So thank you for that question. That's only a reflection of the data gaps, not of the indicators we'll be looking at. Okay. We've got a suggestion for chronic pain data, so thank you very much. And again, if you do have other suggestions, please feel free to send those to us in an email, and we'll make sure that they are considered. All right, so now I'm going to turn it back over to Reem.
Thank you, Zach. As Zach stated, if you do still have feedback that you want to provide on those data gaps that he enumerated, we would be happy to take that. You can feel free to reach out to Zach or to myself or any other member of the HPIO team. We'll make sure it gets to the right place. And we would be happy to take that over the next few weeks. Just to remind everyone of next steps in this work, we do plan to complete the summary assessment by the end of February, and we do anticipate that you'll be able to see some of those key findings prior to release of the summary assessment to the public. And at that time, we will convene this group again, likely in early March, to begin our prioritization process. We will be in touch within the next few weeks to set a date for that March meeting. Things will be moving quickly after that. We will begin to form priority work teams, which you are welcome to be a part of. We'll begin to identify key informants and conduct those interviews and really dig into the work that we will be doing on the Strategic Action Plan on Aging. As all of you will be key partners in implementation of the SAPA. As we move forward, we'd really like to hear from all of you on how you might envision using the SAPA in your work. So again, we'd like to open it up for discussion. Would really like to hear from all of you on the ways that you think this will be helpful to the work that you do and how it can inform your work. You are welcome to join the discussion and make comments by raising your hand or type in comments into the question box. If you've had trouble speaking on the webinar earlier, please make sure that you have input your audio pin and that if you have muted yourself, you have unmuted yourself. We will unmute you on our end, but you may also need to unmute yourself on your end. All right, I see one comment. It will be helpful for educating and advocating with policymakers and federal, state, and local legislators. Thank you, Lark. We do hope that the SAPA will be useful in both your education and advocacy efforts. Other thoughts on how you would envision using the SAPA in your work? Marie, you have your hand raised. We're going to go ahead and unmute you.
I can see the Summit County Public Health and the Summit Coalition for Community Health Improvement using it as we move forward on our both our chip development and we're doing some particular work with Alzheimer's. Our Alzheimer's Association sits at that table, and I think that we will be really glad to have the information to inform our focus on an older population. It's a significant, significant big deal in Summit County, and I can also see us using it at legal aid in terms of identifying need where a legal intervention might be valuable.
Great, thanks, Marie. That is all very, very helpful to hear, particularly the intersection between the SAPA and then alignment with what you're doing at the local level around health improvement activities with community health planning. That is very, very good to hear. Thanks for sharing. We also have a comment speaking for Representative House's office. We plan to use the SAPA for formatting policy and legislation here in Ohio. Wonderful. In addition to informing policy discussion, this will also be helpful for identifying opportunities for exploring new models of care with payers and others. Catherine, thank you for that comment. Rob Applebaum is saying that it's critical to get state policymakers to think of aging policy outside of the Medicaid program, and hopefully SAPA can help with that. Thank you. Representative Ginter is the chair of the Aging and Long-Term Care Committee, and we anticipate using this for informative purposes and to spread awareness about the aging community. Thank you, Megan, for sharing that. Any other ways that have not already been shared? I see a few coming up right now. David Ellsworth says he would love to apply this information to support the health and wellness of people aging with disabilities or aging into life with a disability. Thanks, David. And Marie, these discussions will be helpful to understand the ways in which structural inequalities interact with and aggravate instances of age discrimination and intersectional discrimination. Yes, and that certainly in the draft conceptual framework for the SAPA is something that was emphasized, both a focus on ageism and ableism. Georgia says, I serve on a variety of community boards and committees. The SAPA can help inform our strategic planning priorities. That is great to hear. Thank you, Georgia. And then Angela Weaver says that the Ohio Association of Health Plans will utilize the SAPA work as they develop policies strategically between payers, providers, and the state. We do have Catherine who'd like to make a few comments over the phone. We're going to go ahead and unmute you, but Catherine, please make sure you put in your audio pin. So as soon as you put in your audio pin, we will be able to unmute you so you can speak. And I want to share that Teresa Teeple is saying that practically speaking, the SAPA will align aging network partners in a variety of settings and the broader community around and making a difference in long-standing, deep-rooted issues. Thank you, Teresa. Oh, Catherine, your hand wasn't intentionally raised. Okay, no worries. We will not unmute you. Anything else that folks would like to share on this work? Anything else we should be considering as we are moving forward? You will have many, many opportunities to provide feedback throughout this process. We want to make sure that you are aware of that and do feel comfortable sharing that feedback. So you can do it now, or again, feel free to reach out to us later about either the conceptual framework or the data gaps or other things we should be thinking about as we continue on this work through the next few months. And just as a reminder, the webinar recording and slides will be posted on HPAO's SAPA Advisory Committee page. We'll continue to update that page with new meeting materials and information throughout this process. I wanted to thank everyone for their participation in this meeting. We very much appreciated the feedback that you all have provided and very much look forward to continuing our work with all of you over the next few months. We hope you have a wonderful rest of your afternoon. Thank you.